So essentially what I've done is making a cardboard cutout to represent the posterior semicircular canal, utricle being here, the cupula represented by the orange at the bottom, and also showing the particle in the initial stage at the dependent position because it's escaped from the utricle and lying there. And what we need to do is to get that back through the open end, which is at the superior aspect of the limb, back into the utricle again. And you can see the posterior semicircular canal is at 45 degrees laterally, same plane as the pinna inside. So if you think of the pinna, you can think it's the same as the posterior semicircular canal. In order to bring it to a AP plane or a vertical plane, you need to turn the head 45 degrees this way. And if you come now, what you see is now this is in a plane in that direction. So now we can lie the patient down in the first step of the Dix-Hall pike or the Apley's even treatment step, first step. So what we do is now get the patient to come down and hang the head over the bed, looking at the same direction. If you film, you can see the particle will move from the blue position into the dependent position now, which is the pink position, and closer to the superior limb in order to get it in through there. So you wait for about maybe about 30 seconds until the vertigo that's induced goes away, and then in 2 stages turn the head to the opposite side. So the first stage is 40 to this direction. Now you can see it's turned into a more of a horizontal plane, and the particle will remain there. Very important the patient keeps the head down, because if you lift the head up by accident, the particle will slip back again. So you need to keep the head down during these motions. Now if you come around this way, you can see the next step is to look down while the head is hanging over the bed. Now go on the shoulder on this side and hang the head down to this side. So by doing that, what you've done is get that particle up from the pink position to go to the green position and eventually enter the utricle, which was the aim of the procedure. Now the final step is for the patient to come out with the legs off the bed on the other side while the chin is tucked there always, until you tell the patient to not do so. Sit up while the chin is tucked. While the chin is tucked, you sit upwards and help the patient up. And now what it is that if you come around, you will realize the particle would have entered back into the utricle. So that's essentially the steps of Epley's maneuver to treat right posterior semicircular canal BPPV.